water is a challenge. So now, that already gives you the problem that washing hands will be a problem. And soap is also expensive to the ordinary person. Yeah. Sanitizers are also like masks. The prices have gone high. It's almost like $2, $3, $4. And like Lewis was saying, people earn $1 or less a day. How will they manage? So protection, so sanitizers are not a mask, are not a protection in the health facilities are also a challenge. Social distancing. It's easy for a sparsely populated area to exercise social distancing. But a densely populated area like a shack here in Lusaka, where in a house, a small crowded room that is maybe 3 meter by 3 meter, you have 8 people living in that place. Social distancing already becomes a problem because of the type of housing that our poor people are living in. They cannot afford bigger houses. So social distancing in itself is already a big problem right from the household area. When it goes into in the main streets and so on, our cities are overcrowded in the markets and so on. So social distancing is proving a very big challenge. And the other question was quarantine, self-quarantine. Yes, self-quarantine is one of the norms that we are asking people to do. But again, with the poor people, if they quarantine themselves, where do they get the food? Where do they get the water? Where do they get the money to survive? So self-quarantine is there, but it's proving a very, very big challenge in our Zambian context. I can end there for now.
Okay. Thank you very much, Raphael. I think now we can go to Gasheke. Is there something else that you can add that is uniquely Kenyan that's happening as far as people's response is concerned? And is this adequate? Maybe we can have Gasheke, then Maganga, and then we can go on to the questions being raised, and then we'll have the recommendations by the panelists put forward. Over to you, Gasheke.
So thank you very much, Leonida. It's a very good take from Raphael from Zambia there. And I can confirm our challenges with the African states are similar. The same thing we have in Kenya. How do you do? There is no housing, it's just shack, the same with Zambia. The other bigger problem is access to clean water. There is no water, so even if you tell people to wash their hands, to sanitize themselves, so how do they do that without clean water, or maybe access to piped water daily? Like in the informal settlement in Nairobi here, 7% of our people, 70% of our people live in the informal settlement, and Lewis had said so. They don't have access to clean water. Many of the informal settlements, they don't have water. And as a social justice center, we have been campaigning for access to clean water in the last 5 years, and nothing has happened. So the other thing, we are facing a major problem. Our state it is violent in nature. So they are using police brutality, extortion, crackdown to enforce the curfew. That's another big problem. At the moment, we have 20 cases of extrajudicial killing. And our cases reported that people who have died with COVID-19 is 15 people. So you see the virus has killed lesser people than the police brutality and extrajudicial killing, just trying to enforce the curfew. That's another big problem, that police brutality, extortion is very wide and systematic spread across all the capital city. The ministry have announced today that we have more than almost 400 cases. The number of the cases that have been tested is like 3,000. In a population of 47 million, you can see there is a very big gap in terms of testing. And from the developed country, you can see the reason why they are able to speak authoritatively about the management of this coronavirus is because they have a modern infrastructure of healthcare. But in Africa, and especially here in Nairobi and in our countryside, our healthcare system is very poor, and they cannot be able even to show clearly how this coronavirus is affecting Kenyans. Other big problem that we are facing is that majority of our people, and you know, in the new liberal economy, majority are unemployed or underemployed. So they don't have food. People are starving. Social justice centers have been trying to organize packages of livelihood, especially for our members in the informal settlement. But it's very difficult because this is the work of the government. Majority of our frontline human rights defenders are doing community monitoring of human rights violations, and we are documenting that, and we are issuing a report and condemning the state on what it is doing. Also, we are inviting the state to come and provide people with the basic needs like water, food, access to community health worker, so that they can help people are being affected. That's kind of the challenges that kind of intervention we are provided to our people. But we know very well this is a struggle, and it's a struggle of poor people against the people who have really taken over majority of the resources of the country and have denied our people basic needs. So that's why we are seeing this the social justice movement in Kenya to come together and fight for life, for dignity, and demand to access basic needs and build up a democratic state that can provide people with the basics. That's what I can say. But in a crisis, this manifestation, whatever manifesting in Zambia, poverty, hopelessness, people being killed by police, whether in South Africa, is the same here in Nairobi. And the same big problem with our agriculture is very backward. We're still depending on our people to feed our people with a very rudimentary tools like a djembe. So we're having a very big problem of supply of food in the capital city of Nairobi. A population of almost 5 million people, they are depending on a peasant who has no modern equipment for agriculture to provide food for people in Nairobi. So it is a very difficult. Even it's very difficult. That's why the government are not able to balance between basics and how they can also make sure that the rural people are not, the coronavirus does not go and affect the rural people. Yeah.
Thank you for your input, Gasheke, and painting the actual scenario in the country in terms of people's responses to the virus. I'd like to ask Malcolm just to put across the slide, which shows realities across the continent, and then we'll go on to the question so that this gives the attendees a better view of the situation in Africa. Over to you, Malcolm. Malcolm? Hello, Malcolm? Hello? Okay.
Sorry, Leonida. I just had to leave for one moment to deal with another problem.
Okay.
Just give me 1 second, please.
All right.
I think we'll have to come back again, Leonida. I need a few more moments because I was just dealing with another question. Just to mention, Leonida, that we were going to be going live onto Facebook Live, but there was a problem with Facebook Live. So we have now shifted to YouTube. So we're actually live on YouTube at the time being, on the ILPS official channel on YouTube. So if people were unable to join us on Facebook, they can now join us on YouTube, crossing our fingers, of course. Okay. So I'll be right back with you. I'll set the My apologies. I'll set the slideshow up in just a moment.
Thank you for that. Now let's go to the question, the questions that are coming from the participants, the attendees in this particular webinar. We have questions about lockdown, whether in the African context, how do we feel about the lockdown? Is it hard? By hard lockdown, we mean police repression. What is the level of repression? For example, when you talk about lockdown, are people allowed to leave their houses and things like that? Maybe Maganga, you can tell us what's your perspective of the lockdown situation in Kenya, for instance?
Yeah, thank you very much, Leonida. And of course, thank you also for the speakers. Yeah, as regards that question, soft or hard, I think the explanation there that in Canada, using the lockdown being enforced through tickets being issued, that's soft. Well, in Kenya, in Africa, it is hard. In Kenya and in the rest of Africa, in most of the countries in the South, basically, the relationship between the citizens and the police is really not cooperative. In Kenya, for instance, if you meet a police officer, you're not likely to start negotiating or to speak in a manner that is comradely or brotherly or sisterly or in any of that fashion. In Kenya, I can tell you for sure, when you meet the police, past the curfew limit hours, it's going to be violence. Actually, they're armed with clubs and guns. So, they're going to either, clobber you or, it might even be worse. So in Kenya, it's hard. As regards the answer to that question, I think I'll just say that it's hard. It's hard curfew, violent. That is how it is. Yeah.
Yeah, maybe I can add, Leonida.
Yes, go ahead.
We are saying that police brutality in Kenya is historical. It has been there since our colonial time. The British government colonial government used violence, police violence, killing, mass incarceration of our people, and curfew to repress our people to fight the liberation movement. So this is historical. The state character that we have today is the same one. It has never changed since independence. So that's why they are using police brutality, killings, and it's widespread. And I tell you, in Madare, there's a lot of police brutality. People are being beaten. Criminalization of poverty. If you're found without a mask, you are arrested, detained, and then police ask you for money. So all this is criminalization of poverty for the poor people. So it's a big challenge, and when a state finds it has no solution for our people, it cannot provide them with housing, water. What they have is only instrument of violence to repress the people. And this is different with a developed country where they have well-organized development, housing or healthcare infrastructure. That's a very big difference with the curfew and lockdown that we are facing in Africa. But in the history of Kenya, it is the history of police violence. At the moment, we are speaking about even disappearance of 3 young people here in Madare since Friday. They have not been found. And this is the midst of curfew, the midst of this corona crisis, and there is increase of dozens of disappearance of young people of 24 years to 13. And it has been that way in the last 10 years since this regime of Uhuru Kenyatta came to power. It has been characterized with the police violence, extrajudicial killing, assassination, and silencing of progressive voices. And it has been compounded now with the coronavirus, which has given a government a blanket check to detain people and arrest people in mass and put them in prison and jail without the international media or voice of reason or social justice movement be given a time or space to document this violation. That's how complex this situation is in a country like Kenya, which is undemocratic and compromised in terms of corruption and poor leadership.
Leonida, can I also say something on that? Leonida, can I say something?
Leonida, please unmute yourself.
Okay, you can go ahead, Raphael.
Okay, thanks for giving me the opportunity. Really, as Gacheke has just said, we don't have really a lockdown in Zambia, but there's some form of repression into implementing these measures that have been directed by our government. So police brutality, we are also experiencing it at a high level. People are being beaten and some arrested without any apparent reason and so on. It's just, it has just given them a leeway. It has given them a higher authority from what they've been doing before. Worse still is also the conduct of some ministers and other government officials that have taken it upon themselves to ensure that these measures are taken. And you can see ministers actually going out there harassing people at bus stops, harassing people at markets, harassing people at roadblocks and so on, just to implement that, to make sure that people have masks, and they are complying to what the government has given. So it's just this whole scenario where just that the human rights for individuals are being worked against. And we appreciate the fact that if tough measures are not taken, some people are relaxed, and the COVID-19 pandemic will increase and we have a very bad scenario. But there's a better way of trying to put the message across to people than abusing them, subjecting them to corporal punishment and so on. It's not the right way of doing things. And simple messages can go, engagements can be done with community leaders and so on. So it's not the right thing to do about it, And the other thing is, lockdown means now you need to put in measures about what the people will access. Do you have a program to feed them? Do you have a program or grants or anything else? We hear governments having measures to protect corporate organizations that they have lost business and so on. How about the poor man? These are the contradictions of this capitalistic system. Yeah? Because if a corporate entity needs help, what more an individual who is earning $1 or less a day? Who's more vulnerable between the corporate or the poor people? It's of course the poor people. Yeah. So the measures that are being taken, it's just not lockdown for the sake of lockdown. It must be lockdown with measures attached to it, so that you cushion the sufferings of the poor, and that we are not seeing with our governments. And I think they're running away from their responsibility. It's their responsibility to take care of the people. It's their responsibility. I think that's all for now. Leonida, I'm done.
Leonida, your microphone is off. Yes.
I'm getting used to this. Okay. Okay. Thank you for your contribution, Raphael. Now we have a question from Peter Murphy, who's asking about Labor Day. We know that Labor Day is tomorrow, and workers across the world are supposed to celebrate. Maybe I'd like to ask, Maganga to respond to this. how is Labor Day going to be tomorrow for the workers in the Kenyan context? And what do you think about the African situation? Over to you, Maganga.
Yes, thank you very much, Leonida. Thank you very much for the question. I think it's indeed true that May Day is, an extremely important day for the working people of the world, and of course, for us here in Africa, here in Kenya, it is also extremely important. The question asked if there's going to be rallies for the May Day. There's not going to be physical rallies because of the COVID situation. It's not going to be possible, and it's not been possible to mobilize people for physical meetings. Even our own agitational work at this point has had to be, we've really scaled down on the physical meetings due to this pandemic. However, there is going to be activities that we shall be doing here in Kenya for the May Day. As the Revolutionary Socialist League here in Kenya, we're going to have engagements via social media, via Twitter, via Facebook. We'll go live via Facebook. We're going to have Zoom meetings with a few of the, several of the members of the study circles whom we have, and other people that are going to be in attendance. We're also going to have an engagement with artists that are progressive, artists who are revolutionary, artists who belong to the revolutionary movement here in Kenya. It's actually being organized in conjunction with the Kombozi Library. And, I can even share that, later on, the poster for that. So, the event will be live in Facebook. And, a lot of these activities will be going on, through the social media platforms that we have. So we are going to have activities to commemorate. And of course, we're going to have a statement as the Revolutionary Socialist League, as regards the May Day commemoration. But in terms of physical rallies, that's not going to be possible. But of course, definitely, May Day has to be marked, has to be commemorated. And now that it's finding us at this moment, we are definitely going to stress the impacts of this pandemic on the working class. I think this has to be a rallying call. We have to talk about the impacts, of this pandemic on the healthcare and basically the healthcare of the workers, and basically what the working class makes of this pandemic, and how we can organize at this point, and how we can emerge stronger as members of the working class throughout the world. So yes, I think that covers basically what activities we're going to be doing tomorrow. Back to you, Leonida.
Thank you, Maganga. Another question that we have is basically looking at the discoveries that have been made in Senegal, and Madagascar. For example, Madagascar, the country saying that they have herbal medicine that is effective in addressing COVID, and we've been able to see from the media that the cases of COVID are reducing in that particular country. And for Senegal, we've seen that they're able to provide testing kits at a cost of $1, and they're really testing a lot of Senegalese. What's your take on this? Maybe we can have Raphael respond to this. Over to you, Raphael.
Leonida,
Raphael?
actually, that's a very, very, very interesting. I'm there. Can you hear me?
Yes.
Can you hear me, Leonida?
Yes, I can.
Okay, yeah. That's a very, very interesting topic, Leonida, you brought. Thank you very much for it. And the unfortunate part of it is that because these are African solutions, the buy-in is very, very low, even amongst ourselves as Africans. The case of Senegal, the testing kits that are going to less than $1, very, very few countries have responded. Not even our AU, our African Unity Organization. They have said nothing, and it really pains to see that we cannot even accept our own inventions. The Madagascar case is also the same. It's a herbal remedy. Actually, it's a plant. It's a plant that is said to be originally from China. Actually, that was taken into the Madagascar, and you know there's a big population of Chinese people of Chinese origin in Madagascar, and I think there's a Congolese doctor that is also part of this whole project, and if we are not sure about whether the Madagascar remedy is feasible or not, why not test it? We could just at least ask the people in Madagascar, can we try it? Let's try it. It's a remedy that will sort out our problems as quickly as possible. Because already, if the situation gets out of hand from where it is now, it is a big disaster that we are going to have on this continent. Because we don't have the equipment, we don't have the infrastructure. You know, most of the African countries all implement neoliberal policies. And we've seen the shortcomings of these policies that are here. We should socialize healthcare. We should socialize amenities like water. We should socialize this, but every citizen on the continent has access to these. And if we help our brothers in Senegal and in Madagascar to actually make a reality of these things, the inventions that they've made, then we'll be helping ourselves. We'll be helping ourselves. Then we won't be relying on other products that are coming from China, from Europe, from North America, and so on. We need our own African solutions. Hence, under our Pan-Africanism, we are trying to see that to create synergies in all these things that positives that the African continent has produced so far. We are looking for solutions elsewhere, and sometimes we are ignoring solutions that are just in our backyard. It's not correct. I think maybe it's ideological impotence. What else can we call it? What else can we call it? Because if you cannot accept your own, what you have within your hand, you need to walk to the next person to give you a solution. Then what are you saying about how we are going to take our continent further? Nothing. It's ideologically we are now impotent, because if we understand the polemics of all these things, and we understand the backgrounds of all these things, and the impact that these African solutions will have with us quickly, and then we wouldn't be resisting them. We wouldn't be resisting them. So that's what I can say for now, Leonida.
Response and for painting the picture in terms of how the situation is when we look at African solutions for African problem and the gaps within our different governments. We have another question coming from Rhoda, and she's asking, what are different organizations in these respective countries doing in terms of response? We heard about social justice working group in Kenya providing support to vulnerable households. How's the situation, for example, in Zambia, Raphael? Raphael?
Yes, I'm there, Leonida.
Okay.
The response from organizations and individuals actually has been overwhelming. We have political parties, we have social organizations and so on that are actually providing the face masks, the sanitizers, they are donating to the government, and others are even helping clean the environment. You know, they will move on to markets and so on that are dirty, they'll go and clean up and so on. So everybody is involved in this, seeing that we need each and every citizen to be part and parcel of the solution here. What is actually disturbing is that government has started politicizing the whole exercise. The political party of that is in our ruling are now branding all these donations that are coming to them into their own logos, you see, making it a political move, because we have elections next year. And the COVID-19 has not improved the situation with the current government. That is the most unfortunate part of it. Secondly, they're also trying to malign certain groups and organizations, or trying to bar them from donating. We had a case last week, where our Minister of Religious Affairs, apparently Zambia is a Christian nation, declared by our constitution, and that has brought in a lot of Christian fundamentalism that has come on the fore, and they want to hijack all the scene. And the minister didn't want to get a donation from the Freemasons. So it's just the government's behavior that we are very, very worried about, because it doesn't matter who is donating or who is not donating. Because if you have to look at religious terms, our Muslim and Hindu communities actually have done the biggest donations so far in the country. And regardless of whether the country is Christian or not, or a Christian nation or not, they've taken it upon themselves to help everybody. And that's how everyone should behave, the government inclusive. We need each other in these times. We don't need to start separating ourselves from the whole scenario here. So the response is actually very, very good. Actually, if we had a bigger crisis than what is here, it's actually very encouraging to see that actually the Zambian people are responding positively into all these calls that are being given for them to assist and help. Some have even given out certain buildings to be used as isolation centers. Some are donating sanitizers. Some are donating the thermometers, the temperature reading equipment, and so on. So it's very, very overwhelming, but for our government's response sometimes, which is discouraging people from doing what is good for this whole exercise. And especially political parties, they're also playing their role, and it's actually very, very, very encouraging. That's what I can present for now.
Okay, thank you for your input. The other question that's coming from John, he's asking, what have been the human rights gaps when we have a question coming from John. He's asking, what have been the gaps in some of the African countries and in your country specifically that are related, that have come about when the government is trying to enforce social distancing, when the government is trying to enforce that everybody wears a mask, and also when the government is trying to enforce quarantine as protective mechanisms towards further spread of COVID. Maganga, maybe you can respond to this?
Yes. Yes, thank you, Leonida. I think that's a very, very important question, a very, very good question. And I think in our situation here in Kenya, the response of the government, of course, has exposed the inefficiencies of the regime itself. The government, of course, knows that in order to contain this a pandemic, people really have to have masks, protective masks on. People need to have sanitizers. People need to enforce social distancing. But the paradox is that whereas the failure, because it's a failure, to enforce these measures really proves the inadequacy of the regime itself. These inadequacies are being heaped onto the people. People are being forced to bear the responsibility, the primary responsibility of having these measures, and really, whereas really this responsibility should lie on the government, which they have given the mandate to enforce, or rather to put in place measures to contain such situations. The government in Kenya here requires the citizens to acquire masks on their own. The government requires citizens to acquire hand sanitizers on their own, to acquire detergents, soap on their own, to enforce social distancing, to self-quarantine at their own costs. Yet it is very, very apparent that most people cannot even afford basic needs, let alone these equipment to control the spread of the virus. So the gaps, therefore, are there. I think it's very, very fundamental to see the inability of the people here in Kenya to acquire masks. In fact, as we look into these masks and how they can be acquired, it's interesting to see that at this point, the N95 masks, which are, I think, among the best and most efficient at this period in terms of containing the spread of the virus, go for 1,000, over 1,000 shillings. 1,000 shillings, that's $10. Really, $10 in a population where the majority cannot even earn $2 in a single day. So if you require people to acquire masks for that amount, really that's being irrational. The government should at this point have acquired masks and distributed them to the people, but the government has given that responsibility to citizens. And of course, we know the chaotic nature of capitalism, demand and supply. So at this point, you'd want to acquire masks, but the prices are up by 1,000% or something. So it's really absurd. It's very, very difficult for people to acquire detergents, to acquire hand sanitizers, to enforce social distancing. As Comrade Gasheke correctly pointed out, most of the population in the urban centers in Kenya, Nairobi, for instance, live in informal settlements, in neighborhoods where they're crammed, thousands and thousands of people occupying very, very
I turned it
small,
off, Marine.
occupying very, very small, areas. Therefore, it's not even possible to enforce social distancing here. So I think it's a fundamental flaw in the way our government is handling this case, but also it depicts the failures of our regimes. It depicts the failures of the systems which our regimes are using to govern, and ultimately the failures of capitalism as a mode of production. Thank you, Leonida.
We have another question. We have another question, and this is looking at the budgetary. This will be specifically looking at the budgets, how much countries have allocated in terms of budgets when you're talking about health and public health specifically. This is a question from Marlene, and she's asking whether has our governments been, in terms of budgeting, have they been responsive in terms of how much they've allocated? First of all, the question is how much in terms of the national budget has been allocated to health? Number two is this adequate? Can it take care of the COVID pandemic? And the last question, still on the same, is whether people are demanding better spending in terms of healthcare. Maybe you can have your perspective, then we go to Gasheke. Thank you.
Yes, thank you very much. I think that's also a very, very important question as well. As regards the situation here in Kenya, I think, this was shared, it was even in the news that the government had allocated a total of 40.3 billion shillings. 40.3 billion shillings, I think that translates to $400 million. I think so, yeah. You divide by 100. So I think, yeah, $400 million. Basically, what that means is that the government has spent $400 million over the past more than 40 days since the beginning of the coronavirus pandemic. Is that adequate? I think that has been more than adequate. But the question is, has this money really worked for the people? I think really, if the government has been requiring the citizens of the country to deal with this pandemic on their own, to acquire masks on their own, to acquire protective gear on their own, to acquire sanitizers, detergents, to require, to acquire other supplies on their own. I think for our situation, this would be, a gross, misallocation of funding, because if this has been the amount that has been spent so far, or if this has been the amount that has been allocated, the question would be, how has the government really spent this money if people are required to deal with this pandemic on their own, for their own costs? If we can see hospitals being overwhelmed with patients, if we can see health workers being overwhelmed, at this point in time, then really, how is this allocation of funding working for the people? In Kenya, therefore, I can say that the government really has not, it has allocated money, but we are asking questions. How is this money being used? Where has this money gone if we are forced to deal with this pandemic from our own pockets? I think that's a fundamental question to ask.
Okay, thank you for that. Thank you for input, Maganga. Next, we're going to be asking ourselves, specific, because the pandemic has really exposed vulnerability and inequality. For example, rich people can stock their fridges, but poor people have to wake up every day to go to work, to go and look for ways of survival. Maybe we can ask ourselves, how have we responded to the plight of poor people? Specifically, for example, those living in informal settlements, the migrants, the internally displaced persons, the refugees. In India, for example, according to Malem, they are making it a political responsibility and they're organizing people at the grassroots. How is the situation in Kenya and in Zambia? Maybe Gasheke, you can, given that you represent Mathare, which is an informal settlement, maybe you can give us more input on this. Over to you, Gasheke, and then we'll go to Raphael to get what are the experiences, for example, of Southern Africa region. Thank you.
Okay, thank you, Leonida. This is very important because Mathare Social Justice Center and other social justice center in Nairobi, we're organizing, these are crises, it is affecting us, all of us in informal settlement. And what we are doing is to challenge our people to know that for many years, government have not provided people with healthcare and education. So we have been conducting campaign for right to access healthcare. We have been doing campaign to demand government to provide people with water. And this is a question for social justice. That's why we are trying to bring people together to make sure that our people have been given food, water, and also we issued a statement to demand a government to provide people with their basic needs. That has been very important. We have 16 social justice centers that are spread across all informal settlement. We've been doing community organizing, monitoring human rights violations, and also as other countries also are doing that. Also we are doing fundraising and bringing resources together also to provide basic needs that can help them to survive this corona crisis lockdown. Another important thing is, as a social justice movement, we are articulating this problem to wider society. As you know, tomorrow is Labor Day, but in Kenya there is no trade union. So our voice is being heard, and we have issued a statement many times, demanded the government to be accountable in providing people with the resources and making sure that the police have stopped killing people. We have documented a lot of human rights violation, as you know, a case in Kiamaiko, where a young person was killed called Sam Moyo. He was just standing in a balcony, and police, when they were enforcing the curfew, they came and they shot this young person. So we documented that case. We've been pushing for the government to account on the excesses of the police. So that's what we are doing. But Leonida, I can tell you, these are crises that is ordinary social justice movement or community organization, you cannot be resolved. A history of collapse of healthcare for 30 years, it's not possible for people to solve that kind of problem. What people are doing, yes, they are doing within their locality, mask, improvised mask, using a homemade cloth. That's very important. Or maybe they are making soaps like in Madare and Dandora and Kayole. Young women have made some soap to sell to the local market and to share with the people. Those are self-help initiatives that people are doing. But that's very minimal when you are dealing with a population of 1 million people or 500,000 in different informal settlements. So that's very minimal. So what you can do as a social justice movement is to demand that we have to change these structures that produces beggars. Demand this economy that produces poor people to be changed, because you cannot do this. Let's say this coronavirus takes us 1 year. How many people you can feed for 1 year? It's not possible. Then our political class, like our president, has grabbed all the land. A huge chunk of land is controlled by political class. So you find people don't have even somewhere to cultivate food for self-help, especially in Nairobi. So what we are saying is that we are talking this crisis as a political problem, and a political problem can only be solved by political solutions. And that's why we are building a social justice movement, linking up with the students. And now we have 16 social justice centers in the formal settlement and 30 across the country. So that's a formidable social justice movement that is emerging in Kenya. And we hope as we continue, we'll sharpen the contradiction and make sure that this crisis become ignite a strong political movement for democratic and social justice change.
Thank you for your input, Gasheke. Because of time, we only have like 4 minutes, so we'll not go to Southern Africa to get the experiences, but maybe I'll just take us through briefly through the situation, what is coming out from this conversation. One thing is that we need to celebrate African solutions because they are cheaper and they're also close to us. As you can see in the screen, the COVID cases, they are rising. We cannot say that it's static in the continent, but they are rising. So we have to really respond to that. And then another thing is that the African Union ought to recognize the contributions that are coming from the continent. You know, it should recognize that contribution and give it the due respect. And then the other thing that is coming out is that COVID is being politicized in some countries. And we are seeing, like, for example, the branding that's taking place in in Zambia, in like a political party branding like that, they gave this support. So it's like, and you're seeing that it's also coming at an opportune moment for elections. Many countries are having elections in 2021, 2022, and then so you're looking political parties. Some of them are using this to their advantage in terms of popularity. And then we're also observing from the conversation that the response to the pandemic has been very, very inadequate, and the sector that is most affected has been the health sector. And sadly, we are seeing that COVID is being treated as a health problem, and the intersectionality of COVID to other sectors is not really coming out, because with COVID, there is lockdowns and cessation of movement. And in some areas, food is not coming to the people when it's supposed to come. There are roadblocks being erected. We are seeing markets being closed. We are seeing brutality, for example, in markets. And this is also a problem when you talk about food distribution. And of course, the other thing that is coming out is that COVID has really shown that there is exploitation. It has created breeding grounds for exploitation. For example, you are seeing rising costs of food, rising costs of transport. Places where you used to pay very cheaply now becoming high because the matatus, the public transport system we have across different countries in Africa, have to readjust because they can't carry as many people as they used to do because of social distancing, and now they have to carry less passengers, and they're spending more in terms of the petrol and all that. And all these prices are being transferred to the customers. And then, of course, you are seeing one thing that's coming out, and this is seen in the different countries as represented, and of course, in even the other African countries that are not with us today, is brutality and repression. And you're seeing, like, for example, countries that have lockdowns and curfews, you're seeing people complaining of being beaten. There are even incidences of people being killed. And with that, I'd like to say thank you very much to the participants. I know you braced a lot of cold and bad weather to be with us in this space. And we're still going to have similar conversations in future to discuss the African continent and how the issues of the pandemic is continuing to affect the continent. And you're also going to be having discussions in other countries to try and also learn, for example, from failures that's happening in other countries. What can Africa learn, for example, from different countries in terms of healthcare system, in terms of food systems, in terms of issues around human rights protection. So with that, I think I'd like to say thank you very much to all the panelists. Thank you very much for giving us your contributions and the lived realities in your countries. And to the attendees, we really appreciate you staying with us to listen to the situation in Africa. And also, we look forward to further engagements with you in other similar spaces. Thank you.
Thank you, and bye.
Thank you. Rafael, pass my warmest regards to all the Zambian.
Okay,
Thank
thank
you.
you.
I'm still strong.
Lewis, how are you? I didn't greet you today.
Yes, I'm good, Rafael. How are you?
I'm good.
I'd also like to.
That was very
I'd
good.
also like to invite.
Yes.
I'd also like to invite everyone next week to come to the same space. We'll be sending out the invitations. Karibu sana.
Thank you, Roy, and welcome.
Asante sana.
Thank you.
So we should have our bilateral with Rafael and Lewis.
Yes. Indeed.
Yeah, Rafael.
We are still live. We are still live. Let Malcolm take us out.
When are you coming to Nairobi?
Invite me.
We have invited you now.
You can come now.
Yeah.
Now.
I'll come one of these days. We need to make an ILPS chapter here in Zambia. So we'll learn from you guys, from what you have done so far. Yeah.
Yeah. And please invite and let us know about preparation for election for your party.
Okay. That would be great.
Yeah. Say hi to everybody. All my friends. Tell them we are fighting here, Kenyatta.
Okay, thanks. Bye.
Yes. Greetings.
We're having our own meeting. Sawa Lewis bwana, tuonane town.
Haya, tuonane Gasheke.
Asante.
Haya.